Hi friends, I am Dr. Pinak from GEM Hospital, and today we'll be discussing one of the very important instrument which is very important for the colorectal surgeons. So this is the Allen stirrup, or this is what the Indianized version of the yellowfin stirrup, which is very useful for various positioning, the lithotomy positioning of patients during colorectal or perineal surgeries. So I'll just highlight what are the various important parts to it. So here you can see this is the clamp which attaches to the side of your OT table. So it will have some levers. So this will basically fix it up. So this should be fixed at the level of the hip joint. So this is where the hip joint of the patient should be. And then this is the main stirrup. So there are various parts of it. Okay, so this is the boot. So this is the boot, and this is the clamshelling strap. So basically, it has 3 straps with velcros attached. So the patient's foot will be positioned here, and then we strap it so that the leg doesn't move. Now it has, if you see, it is padded, and if needed, some additional padding can be done. So the original yellowfin comes with a thick silicone pad, but this is a cheaper version. So you might have to use some silicone pad so that there is no pressure. So usually you can see this raised edges will prevent the leg from falling down, and also it prevents pressure. Yeah, so this kind of silicone pad can be used to prevent any additional continuous pressure which can lead to. So now I have, you can see this clamp goes easily inside, and then you tighten it. So once this is tightened, this is the boot handle. So this boot handle can be adjusted up and down as per the need, as per the amount of flexion we need at the knee joint. So one important thing is both should be equal. So this is the hydraulic suspension basically. So this will, and this is the lift assist clamp. So this is the lift assist clamp. Once we clamp it, the lock is released, and this hydraulic suspension allows positioning the limb according to your need. It can go down as well, and it can go up as well. Similarly, a bit of rotation also is possible. So as per the need, we can do that. This is the boot adjustment handle, I say. So this is the hydraulic suspension. So this is after the patient is positioned, you remove the leg support so that the entire perineum gets exposed, and the legs are like this. So if you see that the joint is at the level of the hip, the legs are relaxed and there is no pressure point. If you need any extra padding, you can add a silicone pad to any of the gaps. If you look at the knee, it should be going to the opposite shoulder. The direction should be, knee should be pointing towards the opposite shoulder. Similarly, the other end also will be in such a way that it is pointing to the other shoulder. This position is ready, and we want to expose them. So both the legs should be simultaneously done. So you can see here, on releasing the lift clamps, the hydraulic is active, and I can move the legs as needed. So I can go up like this to expose, and as soon as this is left, it will get locked in this position. So you can see that the entire perineum is exposed. So any procedure you want, you will have full exposure of the perineal area. If you need any like sandbag or something to elevate, that also can be placed. But most of the time, this exposure gives adequate extension and flexion and extension of this area so that you have adequate exposure. Now, few things. This should not be bending too much or falling outside. That should be taken care of. Otherwise, patient may have injury to the superficial perineal nerve. So similarly, when bringing it down, it should be brought down. So it is not only in case of perineal surgery. Sometimes we use this in case of hernia surgeries as well. So you can bring it down this much, and you can stand in between and operate. So this is a very useful instrument for the armamentarium of a colorectal surgeon. Yeah. So this is the hydraulic suspension. So this indicates the degree of lithotomy. Like here we don't have any markers, but if you have that yellowfin original variety, that will have degree of lithotomy. So how much degree it will be indicated in this area. So this particular model doesn't have that, but you can have, if you purchase the yellowfin, you'll have that indicator as well. So there should not be any asymmetry. That is very important. And this should be trained to the OT technicians so that they can understand everything and position the patient, which will be very helpful in conducting perineal procedures. Thank you.